Have you ever felt that sudden tightening in your calf in the middle of the night? The kind that stops your breath for a moment and leaves you wondering what you did wrong? A patient of mine once shared that she tried a warm towel one night and an ice pack the next, but she couldn't understand why heat helped sometimes while cold seemed to work on other days. And I want you to imagine this for a moment. You're lying in bed, exhausted after a long day, when out of nowhere a cramp seizes your leg so sharply that you grip the sheets and wait for it to pass. So many older adults face these nighttime leg cramps without really knowing what brings relief or why different treatments feel different each time. Some people assume heat is always the answer because warmth feels comforting. Others use ice simply because they've heard it reduces pain. But the truth is that leg cramps are far more complex than a one-size-fits-all solution. Muscles cramp for different reasons, and each cause responds differently to heat or cold. That's why today's video will walk you through the real difference between hot treatment for leg cramps and cold treatment for leg cramps. We'll talk in simple terms about how heat opens blood vessels, relaxes tight muscles, and supports circulation. We'll also explore how cold reduces nerve activity and inflammation, making it a better choice for sharp or irritated pain. Neither method is universally better. The key is understanding what your body is trying to tell you in that moment. If you stay with me, you're going to learn how to choose the right method based on your symptoms so you can finally get the restful nights you deserve. This clarity can change the way you care for your legs and help you stop guessing in the middle of the night. And before we move into the next part, take a moment to subscribe, like, and share Senior Health Daily. Your support helps us bring reliable, compassionate care to more people who need it. Why leg cramps happen after 60. As we enter our 60s, the body begins communicating in ways we may not have paid attention to before. Many seniors tell me they feel confused because these cramps seem to appear suddenly, almost without warning. What once felt simple now feels unpredictable. But when we look closer, the reasons behind these leg cramps make far more sense than they initially seem. One of the biggest changes is that our blood vessels lose some of their natural flexibility. When we're young, they expand easily with every heartbeat. With age, they stiffen slowly, making it harder for blood to move through them efficiently. Your muscles rely on steady oxygen, and when that flow changes, cramps begin. Even mild stiffness in the vessels can create a chain reaction that affects the muscles. Muscles also lose hydration more easily with age. They become less resilient, less able to recover after a long day of movement. Some seniors drink less water because thirst cues get weaker, and that alone makes muscles more prone to tightening. At the same time, nerves become more sensitive. They fire signals more quickly and sometimes inaccurately, which can trigger sudden contractions you never expected. A sedentary lifestyle adds to this. Sitting for long periods allows blood to settle in the lower legs. This pooling reduces circulation and increases the likelihood of cramps later in the evening. Medications also play a role for some individuals. Statins, which protect the heart, or diuretics for blood pressure, may make the muscles more reactive at night. All of these factors blend together quietly until the body finally speaks up through discomfort. These cramps aren't random. They're a reflection of how your muscles, nerves, and circulation change over time. How heat treatment works. When seniors ask me why heat feels so comforting during a cramp, I always describe warmth as the body's natural invitation to relax. Heat has a way of loosening the tension that builds inside the muscles, especially when those muscles have been tight or understrained throughout the day. It encourages the blood vessels to open wider, allowing more oxygen and nutrients to reach the areas that need support most. That increased circulation often brings relief faster than people expect. Warmth also calms overactive nerves. When nerves become irritated or overly sensitive, they send signals that cause the muscles to contract suddenly. Heat softens that sensitivity and helps restore a smoother, more balanced communication between the muscles and the nervous system. This is why many seniors feel their muscles slowly release as soon as they apply a warm compress. I remember one woman who visited me after weeks of trying to relieve her nighttime cramps with ice. She couldn't understand why the cold only made her muscles tighten even more. When she switched to a warm towel, she felt an immediate difference. Her calf softened within minutes and the pain faded. Her cramp wasn't caused by inflammation or swelling. It was coming from muscle tension and reduced circulation, and warmth was exactly what her body needed. Heat works best in moments when the muscles feel stiff, heavy, fatigued, or slow to respond. In those cases, warmth acts like a gentle reminder that the body is still capable of relaxing and recovering. Sometimes all it takes is a little heat to stop a cramp in its tracks. How cold treatment works. While heat brings softness and circulation, cold works in a completely different way. Ice has a calming, almost numbing effect on the nerves, which makes it especially helpful when a cramp feels sharp, sudden, or irritated. When nerves fire too quickly or muscles spasm abruptly, cold slows that activity down. It quiets the electrical signals that trigger the painful tightening, giving your body a moment to reset. Cold also reduces inflammation. After a particularly intense cramp, the muscle fibers can become irritated, swollen, or tender to the touch. Applying a cold pack can soothe that discomfort and prevent lingering soreness the next morning. Many seniors tell me that ice brings a deep sense of relief when the pain feels electric or piercing, the kind that shoots through the muscle without warning. I once worked with a gentleman who kept waking up with stabbing cramps that left his calf extremely sore. Heat didn't help him much because his cramps were triggered by irritation rather than tension. When he applied an ice towel immediately after the cramp passed, the soreness faded quickly and the next night was significantly easier. His body needed the cooling effect to calm the nerves and reduce the aftershock of the spasm. Cold treatment shines in situations where the muscle feels hot, irritated, or inflamed. It's not meant to loosen the muscle like heat does. Instead, it protects the tissue from becoming more aggravated and helps the body settle back into a calmer state. For sharp, sudden cramps, cold can be the exact type of relief your muscles are asking for. Heat versus cold. How to choose correctly. One of the most common questions I hear is, how do I know whether to use heat or ice? And the truth is, your body usually tells you exactly what it needs, if you listen closely. Heat and cold feel very different because they act on completely different systems within the muscles. The key is learning how to match the treatment with the sensation you're experiencing in the moment. If your leg feels tight, heavy, or stiff, heat is usually the kinder option. Tight muscles often struggle to receive enough oxygen because the vessels are a bit constricted. Warmth opens those vessels, allowing more blood to flow in, which helps the muscle relax and return to its natural rhythm. Many seniors describe this as a gentle easing, a sense that the muscle finally has room to breathe. Cold, however, works best when the pain feels sharp, sudden, or irritated. A cramp that strikes like a lightning bolt is often driven by nerves firing too quickly or by mild inflammation in the muscle. Ice quiets those signals, slows the irritation, and helps the tissue settle. The relief is more numbing than soothing, but for certain types of cramps, it is the most effective approach. A simple rule of thumb is this: if the muscle feels tight and slow, choose heat. If it feels sharp and irritated, choose ice. Each method supports a different need, and don't be afraid to experiment. Every body responds differently, and sometimes the best clarity comes from observing what feels right for you. What matters most is that you learn to interpret your body's messages with confidence and compassion. Fast leg cramp relief methods. When a cramp strikes, it can feel as if your whole muscle seizes in an instant, leaving you frozen in place. The pain is sharp, urgent, and unsettling, especially when it interrupts your sleep. In those moments, knowing a few simple techniques can make the difference between feeling helpless and feeling in control. One of the fastest ways to ease a cramp is to gently flex your foot upward, bringing your toes toward your shin. This motion stretches the calf and encourages blood to flow back into the tightening muscle. Many seniors tell me that this small movement, though uncomfortable at first, helps the cramp release more quickly. Gentle stretching is another powerful tool. Leaning forward to lengthen the calf or massaging the muscle with slow, steady pressure can interrupt the spasm. I often tell my patients that when you feel a cramp rising, don't panic. Instead, breathe, flex, and support the muscle through the spasm. That calm approach makes a surprising difference. Hydration also plays a role in fast relief. A small sip of water after the cramp begins can help your muscles recover, especially if dehydration contributed to the tightening. Magnesium-rich options, such as magnesium lotion or a supplement recommended by your doctor, can also help soothe the muscle fibers. One important reminder is to avoid jumping out of bed suddenly. Quick movements can worsen the cramp or cause it to rebound. Move slowly, breathe deeply, and let your body guide the release. These simple methods don't require equipment or preparation. They're ways of meeting your body's needs with calm awareness, giving you the tools to restore comfort even in the middle of the night. Senior leg pain treatment you can do at home. Many seniors are surprised to learn how much relief they can create right at home with simple, gentle treatments. You don't need special equipment or complicated routines. What you need is consistency, patience, and an understanding of what your muscles are asking for in the moment. A warm towel or heating pad can be incredibly soothing when the muscles feel stiff or tired. The warmth encourages blood flow, softens tension, and helps the muscles move from a state of strain into relaxation. It's a quiet, steady kind of comfort that pairs well with an evening routine. Cold packs also have their place. When your leg feels irritated or sore after a cramp, a cold towel can bring immediate relief by calming the nerves and reducing minor inflammation. This is especially helpful for cramps that leave the muscle tender the next morning. A few minutes of cold can prevent the discomfort from lingering. For stubborn cramps, alternating between heat and cold can offer a deeper level of relief. The warmth opens the vessels and encourages movement, while the cold quiets irritation. Switching gently between the two helps the muscle reset and recover more fully. Evening leg elevation is another powerful tool. Raising your legs slightly above your heart allows gravity to support circulation. A warm foot bath before bed can loosen stiffness and prepare the muscles for a more peaceful night of rest. And throughout the day, taking short movement breaks prevents blood from pooling in the legs. These at-home treatments are small but meaningful acts of care. They help your muscles remember how to relax, how to receive better circulation, and how to support your comfort every single day. When heat might be harmful. While heat can feel wonderfully soothing for many types of leg cramps, there are moments when it can actually make things worse. This surprises a lot of seniors because warmth is familiar and comforting, something we naturally reach for when the body feels tense. But understanding when to avoid heat is just as important as knowing when to use it. Heat increases blood flow, which is helpful when a muscle is tight or fatigued. However, if the leg is swollen, inflamed, or irritated, adding heat can intensify the problem. The increased circulation may bring more fluid into an already sensitive area, making the discomfort sharper and the swelling more noticeable. There are also situations when the cramp comes from nerve irritation, such as mild sciatica or a pinched nerve. In these cases, heat may aggravate the nerves and cause them to fire even more intensely. One patient once described it as turning up the volume on a pain signal she was trying to quiet. Her cramps worsened until she switched to cold, which helped settle the irritation instead of amplifying it. Heat is also not ideal if the skin itself feels warm or irritated. Applying more heat to already inflamed tissue can create a cycle that is difficult to break. In these cases, your muscle is not asking for warmth. It is asking for calm, coolness, and reduced stimulation. Knowing when to avoid heat is a gentle act of listening. Your body gives clues. If the pain feels swollen, hot, sharp, or nerve-driven, warmth is likely not the right choice. Choosing cold in these moments protects the tissue, reduces irritation, and helps restore balance more effectively. When cold might be harmful. Just as heat is not always the right answer, cold has its own limitations. Many seniors assume that ice is a harmless option since it numbs pain quickly, but there are times when cold can work against what your body truly needs. Understanding these moments helps you avoid unintentionally making your cramps worse. Cold tightens blood vessels. That's helpful when the muscle is inflamed or irritated, but not when the problem is poor circulation. If your legs already struggle to receive enough blood flow, reducing that flow even further with cold can deepen the tension and make the cramp more stubborn. Some patients have told me that their muscles felt locked in place after using ice, not realizing that the cold was restricting the circulation their muscles were begging for. Cold is also not ideal when your muscles feel stiff, heavy, or slow. These sensations often come from reduced circulation or buildup of tension throughout the day. Applying ice in that situation can tighten the tissue even more, making the muscle feel rigid rather than relieved. Another caution is for seniors with underlying vascular conditions. If circulation is already compromised, cold may intensify discomfort or cause numbness that lingers longer than expected. The body needs warmth and gentle stimulation in those cases, not further constriction. Cold can also be problematic if your legs are already cold to the touch. Adding more cold only deepens the chill and makes relaxation harder. Your body is signaling that it needs warmth to restore comfort. Choosing when to avoid cold is another form of listening to your body's wisdom. If the muscle feels slow, tight, cold, or circulation is already limited, ice is not the answer. Trust those sensations. They guide you towards safer and more effective relief. Lifestyle habits that prevent cramps. One of the most empowering truths about leg cramps is that many of them can be prevented with small, thoughtful habits woven into your daily routine. These habits don't require major changes or difficult exercises. Instead, they gently support the circulation, hydration, and muscle balance your legs depend on, especially as you age. Hydration is one of the simplest yet most overlooked habits. As we grow older, our natural sense of thirst becomes less reliable. Many seniors drink far less water than their bodies need, and the muscles respond by tightening more easily. Drinking small amounts throughout the day keeps the muscles hydrated and less prone to sudden contractions, especially at night. Nutrition matters too. Foods rich in magnesium and potassium, like spinach, bananas, and pumpkin seeds, help regulate the electrical activity within your muscles. These nutrients support steady contractions and smoother relaxation, reducing the likelihood of nighttime cramps. Even small dietary adjustments can create meaningful changes. Stretching before bed is another powerful tool. Gentle calf and hamstring stretches encourage the muscles to release accumulated tension from the day. Leg elevation in the evening helps reduce swelling and improves circulation, giving your legs a well-deserved break after hours of standing or sitting. Short walks during the day prevent blood from pooling in the lower legs. Even a few minutes of movement at a time awakens circulation and encourages oxygen to reach the muscles that need it most. Avoiding tight clothing around the calves or waist helps too. Anything that restricts blood flow can contribute to cramps later in the evening. These habits are not complicated. They are quiet forms of self-care that honor your body's needs. Practiced consistently, they build a stronger foundation for comfort, mobility, and peaceful nights. What to tell your doctor? Many seniors hesitate to bring up leg cramps during appointments because they think the problem is too small or too common to mention. But leg cramps can reveal early clues about what your muscles, nerves, and circulation are experiencing. Sharing the right information with your doctor helps create a clearer picture of what your body is trying to communicate. If your cramps are new or becoming more frequent, that alone is worth discussing. Changes over time matter. They help identify whether the cramps are related to circulation, nerves, hydration, medication, or something else entirely. A simple conversation can open the door to meaningful answers. Medication review is another important step. Some seniors experience cramps as a side effect of statins, diuretics, or certain blood pressure medications. Your doctor can adjust timing, dosage, or suggest alternatives to see if the symptoms improve. Small adjustments can bring surprisingly big relief. Blood tests are sometimes helpful too. Checking levels of minerals like magnesium, potassium, and calcium can reveal imbalances that contribute to muscle tightening. Understanding these levels gives you and your doctor a more complete understanding of what your muscles need. Your doctor may also check your circulation using a simple test called an ankle brachial index, which compares blood flow between your arms and legs. If needed, an ultrasound can give a closer look at how blood moves through your vessels. If numbness or tingling accompanies your cramps, your doctor may evaluate potential nerve involvement. Most causes of leg cramps are manageable when addressed early. You don't have to endure the discomfort alone. Talking openly with your doctor gives your body the support it needs and helps ensure your legs stay strong, steady, and capable. Heat versus cold showdown. Final verdict. After exploring both heat and cold, many seniors still ask me the same question: which one is truly better? And the honest answer is that neither method wins every time. Heat and cold each have their place, and the best choice depends entirely on what your body is experiencing in that moment. Heat is the gentle nurturer. It loosens tight muscles, opens blood vessels, and brings comfort when your legs feel heavy, slow, or fatigued. When circulation needs a boost, or the muscles need a soft release, warmth often feels like the perfect match. Cold is the calm protector. It quiets irritated nerves, reduces inflammation, and brings relief when a cramp feels sharp, sudden, or piercing. When the muscle is angry, swollen, or overstimulated, cold gives it the quiet space it needs to reset. The real key is learning to assess what your body is telling you. Before reaching for anything, pause and ask yourself, does this feel tight, or does this feel irritated? Does the muscle feel slow and heavy, or sharp and reactive? Your body speaks through sensation, and matching the right treatment to the right feeling is the most reliable path to relief. Some seniors find that alternating heat and cold works best for stubborn cramps, giving the muscle warmth to open and coolness to calm. Others discover that one method consistently works for them. Both experiences are valid. The goal is not to choose a winner. The goal is to build confidence in understanding your body's signals. When you learn to respond with intention, you become an active partner in your own comfort and healing. As we bring this journey to a close, I want to leave you with something deeper than techniques or treatments. Leg cramps are not signs that your body is failing you. They are messages, quiet signals, small reminders that your muscles, your nerves, and your circulation are asking for attention. The body speaks through sensation long before it ever reaches a breaking point, and learning to listen with compassion is one of the greatest gifts you can give yourself. Your legs have carried you through a lifetime of movement, memories, and milestones. They have supported you through moments of joy and moments of hardship. They have helped you stand, travel, work, care for your family, and build your life one step at a time. They deserve gentleness, patience, and gratitude, not frustration, not blame. And no matter your age, there is hope, real hope. Your circulation can improve, your muscles can grow calmer, your nights can become more peaceful. Even small steps each day can create meaningful change. A little hydration, a few stretches, a moment of warmth or coolness applied with intention. These tiny acts add up, especially when done consistently. What matters most is empowerment. Notice the early signs. Respond before the cramp arrives. Use heat or cold wisely. Move your body with care. These habits create confidence, and confidence brings comfort. Before you leave today, I want you to carry this with you. Your health is a lifelong relationship. Treat it with patience, curiosity, and love. And if this video brought you clarity or comfort, I invite you to subscribe, like, and share Senior Health Daily. You deserve a place where your questions are honored, your challenges are understood, and your well-being always comes first.